BBC Radio Kent.
It is worrying, isn't it, that we're hearing that 3 out of 4 Kent hospital trusts are not meeting government targets for starting cancer treatment. 85% of patients are meant to start treatment within 2 months of an urgent referral by a GP, but that is not happening at East Kent Medway or Maidstone and Tunbridge Wells Trust. That's according to a report, which is being considered at the moment, by the way, by Kent County Council. Well, let's discuss this now. Here in the studio, Mark Norman, our health correspondent, and also with us, Karen Constantine, Labour Kent County Councillor for Ramsgate, who sits on the Health Committee. Starting with you, Mark, if I may. I mean, you know, you've been looking into the health of Kent for some time now. Were you surprised by these figures?
Not surprised. It's not good, is it? They're not alone. Unfortunately, England hasn't met these targets since 2015. 4 years not hitting these targets. And you can imagine for every person who's not getting to see a consultant, you know, for every family member, these are tough, difficult times. Do you know what really disappoints me is the trusts are failing to hit this. But guess what? We have something called the Kent and Medway Cancer Alliance. Who knew? The Kent and Medway Cancer Partnership. We have the Sustainability and Transformation Partnership. Everyone looking at this, everyone knowing cancer is a priority, and we're still not quite hitting these targets. So the trusts take the flak for it, but I think there is a system-wide issue across Kent and Medway. It's a toughie.
Yeah, it is. And we've been discussing this morning several reasons about why this might be the case. What do you think?
Well, I think let's break it down into 3. Demand is one. So, for example, in Maidstone, which is a specialist cancer centre, they've seen a 22% increase in referrals. The national average for the increase in referrals is 13%.
Right.
So loads more people coming in the door with suspected cancers. Workforce vacancies, like every bit of the NHS, they're struggling to find enough staff or the right staff and get them in the jobs and keep them in the jobs.
There, yeah.
And then particular increases in certain types of cancer, so colorectal and breast cancer, for example, and being particular problems, especially in West Kent. So those are some of the reasons. As ever, it's a complicated picture. There is no more money going in, so lots more money from the clinical commissioners, the people who commission these services. They've introduced new clinics to try and deal with it, extending a few doctors' contracts. It'd be nice to see them sign on the dotted for a permanent job. But it's a struggle, but it is a priority.
Do you think then, therefore, things will improve? The figures might be different next time?
God, I've sat here a few times and they tell me yes. I've actually been speaking to a few people over the weekend, knowing I was going to be sitting here talking to you. And apparently they're hitting 80% at the moment. They reckon, some people reckon they could hit the target by October. I've heard that sort of thing before, but they seem very confident about that. There is a big NHS plan saying things need to improve by 2028, but that just adds to my headache because they've been saying this for 20 years. We've had, how many plans have we had that are going to improve things, and we ain't there yet. We'd like to see it happen much more quickly for all those people who are not seeing a consultant in time.
Indeed, and as you say, you know, more instances of cancer as well, so the problem becomes more urgent.
Quite.
Mark, thank you. Good to see you this morning. That's Mark Norman, our health correspondent, with the very latest. Listening to that, Karen Constantine, who, as I mentioned, is Labour Kent County Councillor for Ramsgate and sits on the Health Committee. Encouraged by what Mark said at the end there?
Well, like Mark, I've heard a lot of these plans for improvement mentioned, you know, for years and years now. I think what we need to look at is what the organisations like Cancer Research and Macmillan are saying. So Macmillan Cancer Care are saying that the NHS workforce is completely overstretched and that the political turmoil that we're currently in doesn't really help us. They've also conducted research very recently which shows that 1 in 5 cancer nurses have had to take annual leave in order to update their training. Now, that's not a very good situation. You've got the RCN, the Royal College of Nursing, talking about the nursing shortage, 40,000 nurses short in the system. They're predicting that will grow by to 70,000 by in 5 years. And currently we're 1,400 cancer nurses short. So unless we get the right people in the right place to do the job at the right time, this situation isn't going to resolve itself. And we need to really address the key and central mission critical issue of workforce.
Okay.
And this government isn't doing that.
So how would you personally then go about doing that?
Well, for one thing, the easy thing to do would be to reintroduce the bursaries. The bursaries for nurses were introduced for nursing and midwives, and they really encourage people to go into nursing, and that's the sort of solution that we need. And they need to be funded. We really need to incentivise this process and get more people into training and get more people onto our wards.
Nurses are important, yes. What about oncologists, though? This is a cancer story. How do we get more of those?
Well, we could fund medical degrees so that we get more coming through the system. None of this will work in the short term. This has to be a long-term ambition. But tinkering around, reorganising deck chairs, that doesn't work. That stresses staff. That puts stress in the system, and that doesn't address what Mark Norman was talking about, which is the system-wide problems.
Yeah, and we actually had one of our callers earlier on say part of the problem is a lot of our medical staff here in Kent get sucked into London. Do you see that happening?
Well, I think that is the case. I think staff can get sucked into London. The London shadow does have an impact because people can travel into London and they can earn more money. That needs to be levelled out. We don't want to lose valuable nursing staff. We've seen this in other parts of the NHS locally. We don't want to lose those staff. So maybe we should be looking at the pay structure to make sure that we pay a recruitment premium. To me, that is absolute common sense.
Certainly a lot of things need to be considered. Karen, thank you. Good to talk to you this morning. Karen Constantine, the Labour Kent County Councillor for Ramsgate, sitting on the Health Committee too. Before that, Mark Norman, our health correspondent.